It's called the STOP Act. It went into effect a month and a half ago across our state. The General Assembly passing the law with the hope of reducing the prescription of opioids to prevent addiction. But some with chronic pain argue it's actually hurting the way doctors treat their conditions. WNCT's Josh Birch joins us with more.
Yeah, Ken, one patient in the East tells me the medicine she had been getting this time last year at the same time she no longer can get. Now, patients and professionals alike agree there may be some misunderstandings of current laws and guidelines, creating some big headaches for some in our state.
I have days where I can't even get out of bed.
For chronic pain patients like Jenny Waterman, taking opioids is a necessity every day.
4 to 5 a day.
But following the passage of the STOP Act and new CDC guidelines, getting the necessary prescription is getting a little more difficult.
You can't have as many different medicines as you could before,
including the stronger pills when major flare-ups and migraines hit Waterman several times a year.
If I get in a situation where I have a flare, though, I'm totally out of luck.
It just helps set standards to reduce some variation in prescribing patterns.
Dr. Jason Foltz is the interim medical director for ECU Physicians. He says the confusion some may have about prescribing medicine may have more to do with the CDC guidelines than the STOP Act.
The CDC recommends a three-day supply for acute pain management, and the STOP Act law put a limit of 5 days.
But regardless, medical experts say chronic pain patients shouldn't be impacted by either.
It's unfortunate that some folks are now shying away from treating those individuals appropriately.
Dr. and North Carolina Representative Greg Murphy sponsored and wrote the STOP Act. He says there's specific clauses in it to prevent chronic pain patients from having to repeatedly see their doctor each week to get necessary medicine.
I think some individuals are just going a little bit to the extreme without understanding the implications and the facts of the law itself.
And Drs. Murphy and Foltz both say if patients with chronic pain have concerns about how medicine is being prescribed to them, they should talk directly to their providers. Dr. Murphy says they keep chronic patients in mind when writing an act like this. Josh Birch, down to your side.